Hi, my name is Garrett Sanders. I'm one of the pediatric dentists here at PDANO, and today we're going to talk about fillings and crowns and what those procedures look like for your child. So a common question that we get a lot from parents here at PDAO is, what is the procedural difference for the child as far as their experience if they're getting a filling rather than a crown, or vice versa? And so I want to take time today to explain that to you guys so that if your child is experiencing one of these procedures, you'll have a little bit of a better idea to know what to expect so that you can be prepared for that experience. So we have done other videos that explain why your child may be getting a filling or a crown and the nature of the cavity that they may have and why it would necessitate that. So we're not going to cover that too much here. Mostly we're going to talk about what that looks like and what your child is going to experience the day of the procedure. So we'll start with a filling. So whenever your child has a small cavity, baby tooth or permanent tooth, a lot of times those can be restored with fillings. And so, sort of the basic definition of a filling is you're removing an area of decay and you're creating a hole essentially in the tooth or a vacancy where the soft decayed tooth structure was. And we're putting a resin material into that void. And so we're filling the tooth in with a dental material to replace the destroyed or defective material caused by the cavity. Whenever your kid comes in to have the treatment done, and this goes for crowns or pretty much any invasive dental procedure, the first thing that's typically going to happen is they're going to receive anesthesia. So we're going to numb the area, and that way the child is comfortable during the procedure because some tooth structure will need to be removed, and that can be sensitive if the tooth's not numb. Now, some very small cavities can be fixed without anesthesia, and so you may find that the day of the procedure, the doctor may say that the tooth can be treated without being numb, and if so, that's a bonus. But I would say that's the exception rather than the norm. So after the tooth is numb, if that's necessary, the doctor is going to leave for a little while to allow the anesthesia to take effect. And when they return to the room, the next thing that's going to happen is they're going to typically do something to isolate the tooth. So all of the material that we use for fillings has at least some degree of sensitivity to moisture. And so if saliva or blood gets on the tooth while the material is being placed, then the material doesn't stick very well. And so they'll place a device. Frequently, it's a rubber device called an isolite, and they'll place that in the child's mouth, and it sucks up the moisture, and it kind of keeps the tongue and the cheek out of the way and allows the tooth to be dry. They may use cotton balls or other things, but basically they're trying to keep the tooth from getting moisture on it. Once that's achieved, they'll use the handpiece or the drill, as it's commonly referred to remove the affected area. The child will feel a little bit of vibration during this. There is also noise, and we can sometimes use headphones to mitigate the sound if kids are sensitive to that. But it's not typically that uncomfortable. It's just foreign for some, but it's a sensation that is usually tolerated by most children. And it's pretty brief. So the actual time undergoing drilling is usually just a few minutes, sometimes even just seconds, depending on how big the area that's affected is. And so they'll do that, they'll remove the affected area, and then once that's done, then they go through some steps to bond the material in there and to fill the cavity in. And that doesn't take a long time. And from the child's standpoint, there's no sensation, there's no discomfort, they're completely oblivious. It's all just brushed on, and there's very light tactile touch. So super easy, and the whole process is usually very brief. A lot of fillings can be done on children in under 10 minutes, and so it's not a drawn-out process. So if you find yourself in a situation where your child is going to be coming to our office to have a filling placed, and this video didn't answer all of the questions that you may have about that procedure, we have lots of staff that are available to answer any of your technical questions, and we would be happy to answer those. Feel free to give us a call at any time. We look forward to seeing you.